Hello, I'm Dr. Dennis McKenna. As always, I'm joined by Dr. Fred Venditti, our hospital system general director. Today is Thursday, February 4th, giving you the update from Albany Med. So Fred, the workforce watches these videos.
They do.
And some people in the community watch these videos. And we have a fan. Or I should say I have a fan.
I'm sure you do.
I have a
More
fan.
than one, Dennis.
Well, so today I was shown a picture of a cat named Loki who likes to watch these videos. So shout out to Loki.
Hi, Loki.
We all have to, take what we can get.
That's, well, okay.
So, Capital Region, people admitted to the hospital with COVID-19. Fred, incredible news, we are under 400.
It's tremendous. First time in a long time.
Yes, 392. And as we predicted, you're seeing that curve come down pretty steeply.
Yes, it is.
You know, Fred, one of the questions that was asked recently is, do we expect the variant to change that? Do we think it will go up again? I think the honest answer is, of course, we don't know.
Right.
We certainly hope not. Right now, the data would suggest we're continuing to go down.
That's right, Dennis. And I think it really isn't clear what the variants are going to do.
Right. So good news, under 400. Next graph here, admissions and discharges to the medical center. And this graph, really what it's showing is that we're having more discharges on any given day than admissions, and at least once every other week, we mentioned there's no flu activity here. We've heard a random case here or there of flu B.
Yeah, there are two cases, I think, hospitalized in the region that we've heard on our calls.
If we went back a year ago to February of 2020, actually at that point we were kind of almost finishing the flu season, but we at times would have had 40 or 50 people in the hospital.
Just our hospital.
Yeah,
that's right, Dennis.
Very unusual. And then this is the morning census here at Albany Medical Center, and the graph will show you 107 in the hospital, 24 in the ICU, 13 on a ventilator. It's probably risky, but maybe not that risky to make a prediction. We'll be under 100 by next week would be the direction we're going in.
I think that's a pretty safe prediction, Dennis.
All right, Fred, very few people out there probably remember Johnny Carson.
You and I do.
We do. Some viewers might remember Johnny Carson. He used to have a routine called Karnak the Magnificent. So we're going to do Karnak the Magnificent today.
Yes.
All right? And you play the role of Ed McMahon.
Yes.
Yes.
So I hand you envelopes.
You hand me the envelope, and I will divine the answer in the envelope without even opening it up first. I have to. I cheated. All right. 8853. And then
8853.
And then he used to go like this. What is the number of employees at Albany Medical Center that have had their first dose of COVID-19?
8853.
Very good.
That's tremendous.
All right, let's see here.
The next envelope.
7797.
7797.
You're perfect. Let's see here. I'm not as good as Carson. What is the number of employees at Albany Medical Center that have had their first and their second dose?
That's tremendous.
So that's like 91%.
That's tremendous.
And the last...
I hold in my hand the last envelope.
That's how it's done. All right. Oh, 0.
0.
0.
0.
And this is exciting.
0.
I did that. Did I blow it out? Oh, here it is. All right, here we go. What is the number over the last 2 days of employees who have tested positive for COVID at Albany Med? Unbelievable.
0.
So we went from a day where we had 38 in one day to the last 2 days we've had none.
In less than a month.
Right. So incredible. And even before that, we were hearing 1 or 2. I think we went back over 7 days now. The grand total over the week may be 10 or less. It's great.
Yes.
Great news. So more of that in the future. Really proof here on this campus the vaccine is making a huge difference.
It's made a tremendous difference,
Right.
Dennis.
And in the Capital Region, we know that over 100,000 now is the number that have been vaccinated. So great work there. Fred, we had spoken on Tuesday about something called the Post-COVID Clinic. And I know that earlier today we had an opportunity to have Dr. Tiwari come. We'll introduce her in a second.
Yes.
Fred, what is the Post-COVID-19 Clinic?
So Dennis, people who've recovered from the acute phase of COVID,
Right.
about a third of them have some residual symptoms.
Right.
And so we've established, or our pulmonary group has established a clinic to see those patients.
Yes.
And they have sort of a multi-specialty approach because it can be lots of different types of symptoms involving
Right.
different organ systems, cloudiness, some shortness of breath still. So that clinic is available to 18-year-olds and above,
And above, okay.
and is active right now.
And in order to get in, you have to have proven to have COVID by the form of antibodies
Antibodies?
and no longer be acutely
That's
ill.
right. That's
okay,
right.
very good. And this is run by the Division of Pulmonary and Critical Care Medicine.
That's right, Dennis.
So let's hear from Dr. Tiwari.
You know, initially when the pandemic started, we were just so much focused on the inpatient care and the ICUs, and soon after that initial wave, settled down, we started to realize that all of these patients that are coming out of the hospital and many others who are in the community, they are having these symptoms that need to be taken care of. And there's a huge amount of population that is affected by this. Hence, I think this is extremely, extremely needed. We need to study these people, we need to follow these people, and then we need to be able to offer them, as treatments become available, the best that is out there. So usually the first visit, we like to get a breathing function test on everyone because, as we know, lungs is a very commonly involved organ in this illness. So when they come in, they will first have a breathing function test, and then they will see the doctor, and then further battery of tests will be decided on a case-by-case basis. It's become a public health issue with people who are recovering and not coming back to their original self. These patients are really, they really need to be seen by specialists. Sometimes it is helpful to know that your tests are coming back normal. It helps to reassure that there's nothing that is being missed. Plus, you know that you're connected with the right place. We know that these symptoms are real, and these are very debilitating, and they need to be addressed because this is a big change of life for people who were having normal lives, working, healthy, and now they're not able to go back to work. So psychologically, agreed that it definitely has a big impact on them as well.
So thank you to Dr. Tiwari, and thank you to all of the pulmonary doctors in the Division of Pulmonary and Critical Care Medicine, and in fact, everybody who staffs that clinic.
That's right. It's a multi-specialty clinic, so there are people from other specialties as well.
So let's put the number up on the screen. Obviously, if you'd like to call for an appointment, 262-9340. We're really proud of that clinic, and we thank everybody for making that work.
And Dennis, like a lot of things here at the medical center, it's a group effort. All the pulmonary critical care docs and other specialists participating to make this a very valuable thing.
Absolutely. Fred, let's end on this. We know currently we have 2 vaccines that have been approved by major pharmaceutical manufacturers, Pfizer and Moderna.
That's right.
You've mentioned in the past there's more coming, Johnson & Johnson being one, AstraZeneca being another. While not yet approved yet, we think it's going to happen soon. You've begun to read some information on AstraZeneca. What are we learning?
So the group at Oxford has actually pre-published in Lancet some data on the AstraZeneca vaccine. So it's very interesting. So there are a couple of points. So first of all, it works. And with an efficacy, depending on the different dosing and time frame, about 65 to 80%.
Right.
And interestingly enough, the booster dose given later results in higher efficacy.
How far after
Actually,
is the booster dose?
one group all the way 12 weeks out.
Okay.
So that's one interesting point that they made. They then looked at asymptomatic
Yes.
cases, and this is relevant to transmission. And what they've shown is that there's probably a 67% reduction
Wow.
in infections in total, asymptomatic and symptomatic. So that means transmission is going to be reduced with this vaccine. And then the third thing, in their placebo group,
Yes.
they swabbed everybody so they know who's asymptomatic. They know in that group that 40% of the patients who are COVID positive are asymptomatic.
Right.
So remember, we've talked about how
Right.
many people are asymptomatic.
Right.
Is it the majority? Is
Right.
it a small minority? Here's some hard data now. 40%.
40%.
40%.
All right, great. So we know that Enid Geyer and her team will probably take that article and put it on
Lancet
on the site.
pre-publication, yep.
All right, excellent. Thank you, Fred. Well, we want more vaccines to be approved because obviously in this region we know that although we have vaccinated over 100,000, we need to vaccinate 1 million.
Million,
And so
that's
we have a
right.
lot of work to do. So the more vaccine we get, the more of that work we can do. All right, good. That's good news. We'll end on that. All sorts of good news today. Admissions going down, vaccination rates going up, 0 testing positive.
Yeah.
Last couple of days. Great news all around.
Yes, Karnak,
Carn-
thank you.
It is magnificent.
It is.
It is magnificent. And Loki. Once again, we thank Loki for watching us.
Yeah.
All right, we'll be back again on Tuesday. For those of us who are working over the weekend, for those of you who are here in the hospital, we thank you very much for that. We'll see you next week. We ask that you once again, please take care of yourself, take care of each other, and we'll see you on Tuesday.